Hello everyone, Zoe is here with another video and another guest. Today I'm going to interview Faraz Hedayat Suresh, who is a dentist in Sydney. If you want to know how to be a dentist and what is the process that you need to go through, watch this video. Hi Dr. Faraz, thank you for joining us today. Can you please tell us a bit about yourself and your career journey, please, to start?
Hello, it's my pleasure. My name is Faraz. I'm a dentist. My career journey started by a decision made by a teenager.
Wow.
When I was a student in high school, maybe in year 10, I decided to become a dentist.
Mm-hmm.
As we got closer to the university entrance exam, I was under pressure to select medicine instead of dentistry. But I resisted because dentistry was my passion. Finally, I entered Shahid Beheshti Dental School with a very good score. After 6 years, I graduated and I was allocated to Ahvaz to do my mandatory military service.
That's true.
Ahvaz is the metropolis in southwest of Iran with an extremely hot weather and lovely people. I published my practice there only for those 2 years, which we had to stay there for my military service. When I finished my military service, I had already had a very successful practice and many loyal patients. So we decided to stay some more years. And those 2 years extended to 14 years.
Wow, 14 years in
Ahvaz. 14 years. And then through a very complex procedure, we came to Australia in 2014, and then going back to the drawing board. Everything from the beginning.
Yeah, that's true. That's very interesting. Can I ask you where that pressure was coming from? Was that from family?
From my mother,
okay.
Mostly from.
That's yeah, typical Persian family. Cool. Thank you for letting us know. You mentioned that you've been qualified in Iran and then you moved to Australia. So can you tell us about the process, how you went into the process to be qualified in Australia then to be a dentist?
Yes. As I said, I graduated in Iran in year 2000. To validate my dental degree, I should have passed 3 phases of exams. The language, the theoretical exam, and finally the practical exam, the most difficult one. The first exam was the language exam. That time, ADC, Australian Dental Council, was not accepting IELTS. And we needed to pass a very specific exam called OET, Occupational English Test, which was designed only for medical professionals. As opposed to IELTS or TOEFL, there was no many sources for that exam. And I've heard that now they are accepting IELTS as well. The next step was the theoretical exam. To sit that exam, I had to go to Dubai. That was a rather simple multiple choice test, which was held on a single day, morning and afternoon. And the last step was the clinical exam. It was like the snake and ladder game. 5-day full-time exam. The success rate for that exam was less than 10%. 10% of those students who had already passed the 2 first exams.
First reports, wow.
Anyway, after passing all these 3 exams, ADC accepted me as a dentist, and I became eligible to apply for permanent residency of Australia. And I applied.
That's very interesting. So you've done all of them overseas. And then you applied to
Except the last step. The practical exam only held and is holding in Australia.
Okay, so you've done the first two part, then you applied for your permanency, you came to Australia, and then you've done the third part as practical.
First in Tehran, second, which was a theoretical in Dubai,
Yeah.
and third in Australia.
Okay,
and then applying for residency in Iran.
that's true.
I'm
Wow,
waiting for
that must be very hard.
much harder than expected.
Sounds very interesting, Faraz. So as far as I know, in Australia, to be eligible to be a dentist, you need to pass three parts. Like you have to get your bachelor degree at first, and then you need to be doctor of dental medicine. And then for the third part, you need to be registered with dental board. Is that true, or is there any other exam included with those parts for someone who is studying in Australia and is not an international student, or like even for you who has been like an eligible dentist who can work in Australia, do you need to do any other exam ongoing like in the future, or you are a dentist and that's it?
Okay. What you said, in principle, that's correct. But after the full registration, all dental practitioners need to complete a minimum of 60 hours of CPD activities over a 3-year period. CPD stands for Continuing Professional Development Resources. It means that we always should study.
Wow.
It's not stopping.
That's true. Wow. That's right. Is that all about like being updated with what is happening in the world, or it's just
Exactly.
okay?
Yes. Yes.
That's
Updated, learning new skills.
so. My next question would be, like there are some specific areas like implants, orthodoncies. Like as a dentist, are you eligible to do all of those parts, or you need to do some specific exam or process or something to be eligible to those, to be specialized in any of those parts?
In dental field, a specialty is a bit different.
Mhm.
Any dentist who has achieved enough relevant knowledge and is capable of offering acceptable standard service is in almost any field legally can do that. There are a few exceptions. In other words, a general dentist is authorized to do almost any dental procedure as long as they can demonstrate their competence. And the competence can be approved by the courses the dentist has completed and the long history of success in such treatments. And whenever a general dentist feels that a treatment is beyond their knowledge, experience, or equipment, it's the time to refer the patient to the relevant specialist.
Mhm.
You see, there are very limited areas we cannot do. Anyway, for example, if we want to do rhinoplasty, we need to get first, and it's usually only in oromaxillofacial surgery
Mhm.
field. Otherwise, no. I'm doing orthodontics, I'm doing implants, but there are some cases I cannot do. I refer them.
So you
And
need your
specialists are doing a very important job in our field. But no, to do orthodontics, I have many successful cases I can show, and I had passed, I completed many courses.
Mhm. That's true. So, as a dentist, you are able to do all of those specific areas like implants, orthodoncy, or anything.
As opposed to medicine.
And my next question is about students who are studying in university. Like, while they are studying, do you advise them if they become a dentistry assistant to kind of like
Mhm.
get familiar with the environment, to just know what is happening there?
I think that's a very good idea to get more familiar with the field. And anyway, in the close future, Australia will need more registered dental nurses as well.
That's right.
It can be interesting by itself. Besides that, dental therapists and dental hygienists are playing a very major role in the dental field as well.
Mhm. So someone who is studying dental hygienist or someone who is a registered nurse as well, they are
Yeah.
eligible to be a dentistry assistant, and you recommend them to start with such a job like that, right?
I think all dental hygienists, dental therapists, and registered nurses, they all can apply for the next step, which is dentistry.
That's true. Can I also ask you about like how is working hours and wages and salary for a dentist? Like, is that kind of like a standard working hours for you guys, or how about wages?
From zero to the sky, it can be very different. And this income highly depends on what services we offer,
Mm,
the quality of those offered services, the location, and finally, the last but not the least, the communication skills, which is very important, I think.
mhm.
I think the dentists should increase their income by offering more valuable services and enhancing the quality of those services rather than just working more hours. I think it's the worst case scenario that a dentist increases the income by only increasing the working hours. We are working with our brains, hands, and eyes.
Mm.
It's a lot of pressure just to increase the working hours. Maybe those more hours should be spent in the libraries and courses to improve their knowledge and skills.
So you recommend them to instead of increasing their working hours, increase their knowledge. So then, of
Exactly.
course, at the
Yeah.
end, they can make more money.
Yes, yes.
For international students who are looking for the job, or for students who are graduated from university and they really want to be a dentist, like, is there any tip or advice that you can help them to achieve their goals?
The procedure I explained very briefly is doable and the target is achievable.
Mm-hmm.
But the path is not smooth. My first advice is that start it only if you are really committed to your goal.
Mm-hmm.
If so, sooner or later, you will succeed. Some people or colleagues may tell you that it's not possible, there is discrimination, there is racism, and this is my advice. Please focus only on your goal, and to achieve your goal, listen only to the people who have achieved the same goal. Don't let anybody disappoint you.
Mm. That's exactly, and that's the whole idea of this video that I'm preparing and sharing
Mhm.
it with them, like to just let them know there are many other people who already succeed and they achieve their goal, and like it can give them some positive energy that I can do that as well. And at the end, I want to add one bonus question for like for those who are interested about dentistry. Like, can you tell us, like, I was watching your videos on YouTube and you were giving a lot of nice information to people about dentistry and what is going on in a dentist's life. So there was one thing which was very interesting for me, and I would love to be shared with others if it's okay. It was about human teeth. That what is the reason that we need to look after our teeth as a human, but it's not a case and it's not a fact for animals. So what is the reason and what is the difference between us and animals?
The teeth reflects the natural diet determined by the nature. It holds true for any animal. So if we look at the human teeth, first we notice that we have all the instruments to eat vegetables, fruits, and meat. So the teeth tell us that we are not vegetarians. The next thing we find in human teeth is a very thick layer of enamel, which doesn't match our ancestors. This thickness tells us that we are supposed to eat much harder and tougher foods. But the main difference between us and the ancestors is not the teeth themselves. The main difference is the growth of the jaws. All the mammals who are living on dry land reach their full potential growth in their jaws. But the modern human jaws are very underdeveloped, small, and deficient. That's why we have many issues with our teeth that the free animals don't.
Mm.
And as you said, I've made some videos in this regard, and if you are interested, you're more than welcome to watch them on YouTube.
Yeah, fantastic. I definitely provide the link below for anyone who is interested to have a
Thank
look on
you.
your YouTube channel.
Thank you.
I really appreciate your time, Faraz. Thank you so much for joining us today.
You're welcome. That was my pleasure.
Okay, guys, hope you enjoyed watching the conversation. If you have any question, comment below. Faraz will check out your questions and give me thumbs up if you like the video. And don't forget to subscribe me, please, if you want me to produce more video like this for you. Thank you.